episodes of Phatak Materia Medica live series. Today we will discuss another medicine remedy from the Phatak Materia Medica. The remedy is a nosode, a first nosode of this series, that is Anthracinum. So Anthracinum is a remedy of malignant septic destruction. So we will study this remedy in a different perspective. Like routine, we will discuss in a different manner so that it is easy to understand and useful in day-to-day clinical practice or useful in prescribing the anthracinum. So Dr. Phatak described it as a malignant inflammation, septic inflammation of the connective or cellular tissue, carbuncle, malignant ulcers, abscesses with purulent focus, gangrene. So this is not a simple pus remedy, it is or not a simple boil remedy. It is a remedy of putrefaction, sepsis, black discoloration and tissue destruction. So it deeply acts on cellular tissue, glands, blood, septic focus. So whenever the infection becomes aggressive, destructive and toxic in appearance, think of anacardium. So the system is essence or remedy personality of the anthracinum is poisoned vitality. The vitality is poisoned. So the system behaves as if blood is infected, tissue is dying, vitality is collapsing. So there is intense burning, great frustration, black discoloration, black and blue blister. So this is not a lively inflammatory patient, this is a septic collapsing patient. When inflammation turns black, when burning comes with exhaustion, when pus look like toxic, think of anacardium. In Phatak gives a limited mental symptoms, but clinically we observe that the patient feels toxic, weak, restlessness due to the suffering, irritability from pain. So there is exhaustion, septic suffering, collapse tendency. In physical general, remarkable 5 keynotes or 5 observation we should think about or remember about the anthracinum is that burning pains, terrible burning pains, discharges, thick, black, tar-like, hemorrhages, again thick, black, tar-like, edema, cellular tissue, swollen and indurated, prostration, extreme prostration with weakness, thermally hot due to the septic inflammation, marked prostration, indurated, hard, stony feeling of the tissue. So burning, black discoloration and prostration, think of anacardium. So in boil and carbuncle, recurrent boils, successive boils, boils turn black, surrounding tissue indurated. So this is a classic carbuncle remedy. Hemorrhages, thick, black, tar-like from any orifices. Blisters, very characteristic blisters, black, blue blisters, dark, ecchymosis, gangrenous tendency. Ulcers, malignant ulcer, septic offensive, rapid destruction, gland, swollen, indurated, hard, stony swelling, especially light lower jaw and submaxillary gland, severe glandular infection, deep abscess formation. So bad effects of inhaling foul odor. Interesting clinical point that exposure to putrefied smell lead to systemic disturbance, indicates hypersensitivity to septic miasm. So deep nasal septum abscess, quinsy with abscess formation, gangrene, destructive wound, tissue destruction. So anthracinum must be seen in carbuncles, cellulitis, septic abscess, glandular ulcers, necrotizing infection, severe tonsillar abscess, advanced glandular suppuration. In laboratory investigation, we may see that increased WBC count, increased CRP, pus culture positive, tissue necrosis on imaging. So remember, we are not replacing the emergency care, we are understanding the remedy with similarity. So anthracinum corresponds to aggressive septic pathology with black discoloration and burning. So let us some remedies which are close or related to these anthracinum. So one of the clear-cut remedy is arsenic. So arsenic has burning pain, prostration, septic state. These both have common things, but arsenic have marked anxiety, fear of death, and restlessness. Anthracinum has less anxiety, more tissue destruction, black tar-like discharges. So arsenic burns with fear. Anthracinum burns with black discoloration. Another remedy has anthracinum with tarantula cubes. Both have carbuncles, septic inflammation, but tarantula has intense pain, bluish swelling, rapid abscess formation. Tarantula has intense pain, bluish swelling, rapid abscess formation, while anthracinum is black tar-like hemorrhages, more gangrenous tendency, more prostration. Another closely related remedy is lachesis. Both have septic state and dark discoloration. So, but lachesis is left-sided, talkative, night aggravation, sensitive to touch around the neck. But anthracinum is more glandular, black bleeding, carbuncle focus. So, let us understand the prescribing totality of the anthracinum, which is burning inflammation, burning pains, septic inflammation, black or bluish discoloration, thick tar-like bleeding or discharges, indurated glandular swelling, marked prostration. So, not every boil is anthracinum, but the boil or carbuncle which is black, burning, septic deserves attention like anthracinum. So, the common mistakes that clinically made while prescribing anthracinum: giving a simple carbuncle or furuncle with septic character anthracinum, confusing arsenic, both have burning, prescribing only on gangrene without totality. So, black is the center theme of anthracinum: black blood, black blister, black ulcer, black discoloration. So, pathology is dark and destructive and black. As remedies, we have related remedies have arsenic, tarantula, lachesis, crotalus, as described by Dr. Phatak, pyrogenum. So, arsenic has more anxiety and more burning. Pyrogenum has more septic fever with disproportionate to pulse. Here the pulse and temperature are disproportionate in the pyrogenum. In tarantula cubes, more rapid abscess formation and severe pain is a characteristic of tarantula cubes. In anthracinum, more gangrenous, black, destructive focus. In potency, low or medium potencies like 30 to 100 prescribed. As an intercurrent, I will in many cases of skin diseases, I will prescribe of 1 dose of anthracinum. So, in 3 words, how to describe the anthracinum is burning, black, septic discoloration, septic destruction is a anthracinum. When infection becomes malignant, when tissues look like poison, when black replaces red, anthracinum should be come in our mind. So, the core, what happens? Why does the tissue become black? Why does the inflammation turn destructive? Why does pus look like toxic? So, anthracinum represent a failure of vitality against septic invasion. This is not a just infection. This is a septic infiltration, rapid tissue degeneration, cellular breakdown, blood toxicity. Body is overwhelmed. So, in miasm, Anthracinum connect miasmatic understanding of anthracinum. Anthracinum is strongly connected to septic state, gangrenous tendency, rapid destruction. This shows that it has a syphilitic miasmatic background because tissue destruction, ulceration, black discoloration, gangrene, induration, these are the classic syphilitic themes. But there is also septic toxemia that overlaps with the septic miasmatic remedies such as pyrogenum, crotalus and arsenicum. So when destruction dominates the construction, think of syphilitic miasm. Tissue behavioral problem. So how does the tissue behaves in the anthracinum? In stage first, inflammation, swelling, heat, pain. In second stage, induration, hard stony swelling, glandular involvement, cellular tissue edematous but hard. In third stage, thick pus, offensive discharges, purulent focus. In fourth stage, destruction, black discoloration, gangrene, tar-like hemorrhages. This process is very important clinically. Not every carbuncle needs anthracinum, but when carbuncle becomes indurated, bluish black, exhausting and septic, think of anthracinum. So how does in this episode we understand the remedy in a different way? How does the patient comes or case comes in our clinic? So patient comes with carbuncle on neck. He says that it starts like a small boil, but now it is spreading. Center is dark. Burning is terrible burning pain. I feel weak, exhausted. On examination, surrounding tissue hard, discharge dark, patient look toxic with rapid pulse. Blood reports have increased WBC count, increased CRP. So this is not a simple hip or self case or a belladonna stage, or it is a moving towards the septic destruction. So if it is black discoloration, think of black discoloration plus prostration, think of anthracinum. So in the special clinical fields that we must understand, while prescribing the anthracinum, is carbuncle in diabetic patient. Very useful clinical indication is carbuncle in diabetic people. Diabetic patients where carbuncle becomes indurated, hard, dark center, septic. So anthracinum may correspond when back necrotic tendency appears. In glandular abscesses, especially submandibular gland, right lower jaw, stony hard swelling. Septic hemorrhages like thick, black, tar-like, there is no bright red bleeding. This is dark, altered bleeding. It is very characteristic. Another classic indication of anthracinum is septic quinsy or tonsillar abscess. When throat look like dark, offensive, deep septic, compare with mercurus, mercvivus, lachesis, hipparsulf, elianthus, diphtherinum. But if black discoloration tendency appears, think of anthracinum. So commonly remedies that close in these all condition is pyrogenum. Pyrogenum and anthracinum both have septic stage toxemia, high inflammatory markers in the blood reports, but key difference is in pyrogenum, as I have already told you, that pulse is out of proportion to temperature, extreme restless, bed feels too hard. Anthracinum is more local tissue destruction, black tar-like discharges, gangrenous focus. So the pyrogenum is septic fever remedy, anthracinum is septic tissue destruction remedy. The difference is very clear cut. Septic fever remedy and septic destruction remedy. So another remedy which is very close to it's the crotalus. Both have dark hemorrhages, septic tendency, gangrenous stage. But crotalus has hemorrhagic diathesis, jaundice tendency, more systemic bleeding disorder. So in Crotalus mainly the liver is affected. The bleeding is due to the liver, due to the clotting factors, due to the jaundice, due to the liver toxicity, hepatorenal syndrome. But in Anthracinum, more localized carbuncular septic focus, indurated gland and cellular tissue involvement. So in many cases where how can we think in carbuncle or boils? So stage of inflammation, think of belladonna. In pain, redness, burning. In second stage, hyparsal. And when this is black stage after septic black stage, think of anthracinum. So never forget the anthracinum where there is blackness, burning, induration, septic tissue and prostration. Black, burning, induration, septic tissue with prostration, think of anthracinum. So when the patient comes with boils, carbuncles, abscess, gangrenous ulcer, septic gland, don't jump to this remedy directly. Ask them how it begins. Small red swelling first, rapid spread, color changes. Anthracinum usually begins as a ordinary inflammation and then turns into the destructive. So ask about the color change. If it becomes black, center is black, bluish patch, think of anthracinum. Ask about discharges, thick, offensive, dark, almost star-like characteristic, which is of a anthracinum. And anthracinum has terrible burning in the abscesses. So observe the look of patient, toxicity, prostration, drained, collapse. This is characteristic of prostration of anthracinum. So in early stage of abscess, think of belladonna. Suppurative yellow stage, think of hyparsal, mercurius, silicea. Rapid bluish swelling, think of tarantula cubens. Septic fever with pus, with pulse mismatch with temperature, think of pyrogenum. Black destructive discoloration, think of anthracinum. So this is the all about anthracinum as we have discussed in above all examples. So as already I have told you that the key features of blackness, burning, induration, septic focus with collapse tendency, think of anthracinum. So this is all about the anthracinum as a nosode. It is very important remedy in day-to-day practice in conditions where the carbuncles, boils, diabetic cellulitis or carbuncles and septicemia cellulitis. So what are the how does we go to the prescribing the anthracinum? In key is the septic miasm, hemorrhages, destruction and black color discussion. This is all about the anthracinum, as Dr. Phatak did not describe it in details, but we must study this remedy in different sources so we can understand the clear picture of this remedy and utilize in day-to-day practice. Thank you very much for patient listening. Thank you. See you in the next episode.